We have with us Dr. Niklesh Jain, Director and Operation Head at Department of Critical Care Services in Indore. We welcome you, Doctor, to the Natco Pharma Specialty Criticon 2024. What we look forward to hearing from you is your advice for the young generation doctors in the space of critical care associated with antibacterial resistance. And my very first question to you is, how do you foresee the changes in critical care management?
Well, probably critical care management, paradoxically, will become more impersonal. You will have more of emphasis on wearables, probably using more AI and hemodynamic monitoring. And probably we will have certain algorithms to actually, use them practically at bedside. This is the type of change that I foresee in the future.
So everybody seems to be talking about AI. I think that's the most awaited future in the medical space.
I'll put it that way.
Um, what would be your advice to the young ICU doctors for them to enhance patient care?
Right. First of all, is dissemination of knowledge and education, both, because that is something that will keep you in good stead in your profession as well as in your team. Second thing is, of course, to believe in teamwork. Thirdly, be judicious in your treatment. Sometimes, we may overtreat the patients. So there's a very important boundary line which is, not supposed to be crossed whenever we think in terms of treating these patients.
Oh, I think that's a very nice thing that you've said. The boundary line is important. My third question and my final question to you is, what is the prevalence of carbapenems producing bacteria in your practice, and which is the best treatment option?
In my place, majority CR, carbapenem resistant bacteria. The one that predominates is Klebsiella, and that is the one which causes most of the problems. So when we talk in terms of treatment of that, I'm fortunate to have a Carbar facility in-house. So we have actually been able to curb a lot of these patients. But whether routine screenings will help, whether it will go a long way in catching up these patients early, it will still take some time to formulate those kind of strategies. What we do is we treat infection. We're not able to preempt them. So probably the time is coming probably to preempt them and treat them early. That's what I.
Wow. Dr. Jain, we thank you so much for your time, your valuable time here at the Natco Pharma Specialty Studio. We wish you all the best in your practice.